This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about perimenopause and menopause. Our guest today is Dr. Denise Millstine, an internist specializing in women's health and integrative medicine at Mayo Clinic in Scottsdale, Arizona. Dr. Millstine has her own podcast, Read, Talk, Grow, which features authors of books, either fiction, memoir, or narrative nonfiction, that portray women's health conditions. They then dissect those portrayals with an expert on that condition. Dr. Millstine, thank you so much for joining us today. We're thrilled to have you here.
My pleasure.
Dr. Millstine, you're here today to talk with us about menopause. There's a lot of confusion and misinformation that you're going to help us clear up. To start, some people might not know that there are two lesser-known stages that come before that, premenopause and then perimenopause. So first things first, what is premenopause?
Kristen, this is confusing for so many people. So premenopausal, that is from the time you get your period until you become perimenopausal.
And premenopause starts in the teenage years, sometimes even younger for most.
Exactly.
Okay, and then you said the next stage is perimenopause. How do you define perimenopause?
Perimenopause is this period of time that leads up to menopause, and it can be several years, 4 to 8, where the periods start to become less regular, less predictable. They might be lighter, but they might be heavier. They might be more frequent, or they might be spaced farther apart. And you aren't consistently ovulating or releasing an egg in the same way that you were when you were premenopausal and had those very regular, predictable cycles. If you're somebody who has symptoms around your periods, like cramps, headaches, back pain, all those typical symptoms, you're so used to having them on this cadence that might be around 28 days, which is just the classic time for a menstrual cycle. But now you're getting this headache out of the blue. Turns out you're about to get your period. And so the symptoms of perimenopause can be confusing for the woman herself, and they can be very confusing if you're seeking medical care.
You said the most obvious sign that you may be in perimenopause is periods are spaced differently, periods are coming to an end, and so on. What is actually happening behind the scenes in the body that's causing the period to slow down, to stop, to be spaced out differently, and so on?
So what's always causing your cycles is this shift in your hormones, a rise in your estrogen that then causes you to form a follicle in the ovary that then starts to release progesterone. And if you don't get pregnant, then both the estrogen and the progesterone dip and you get your period. So what's happening in perimenopause is those rises and falls in those hormone levels are less predictable. You are not always forming a follicle. You are not always releasing an egg. And so the feedback mechanisms that exist in a woman's physiology aren't having the typical signals to respond to. And so that's why you don't always bleed around the same time or feel the release of that egg.
I do have to point out that some people have ovaries but don't have a uterus. So maybe they don't have a period to even say, oh, my periods are spaced out differently now. How would they know if they're in perimenopause?
So you bring up an excellent point that not all women bleed. They might have had a hysterectomy. They might have had an ablation or procedure where the inside of the uterus is burned in such a way that they're not having those monthly episodes of bleeding. They might have an IUD in place that keeps them from getting that typical pattern of bleeding. And now that's going to look different depending on what your anatomy is, what your tissue is, and how it responds to those changes in hormones. And there could be any number of ways that that would manifest, and it would really depend on what your own situation was. So I would strongly suggest if you're in one of those situations, you talk to your healthcare team and make sure they help you understand, is this perimenopause or is this menopause or are you still premenopausal?
So you've talked about premenopausal and perimenopausal. Let's talk about menopause itself. What exactly is happening there?
So let's even go one step back. We talk about the menopause transition. That's the time when you stop having periods for a total of 12 months. So you've gone through the menopause transition, but can't be diagnosed as being menopausal until it's lasted for an entire year. So once you've gone through the menopause transition, essentially your ovaries are not responding in this cyclical way. They have stopped making estrogen and progesterone in the same levels that they were making prior to transitioning. So you won't be getting these up and down cycles. You won't be releasing eggs and you won't be getting regular bleeding once you become menopausal.
And when does menopause typically occur for most people?
So the average age for women to go through menopause is around 51 years.
And what symptoms might one expect or would you see in patients who are in that menopause, either transition or who are postmenopausal?
So the symptoms can totally run the gamut. There can be so many of them. The most common set of symptoms is something that we call vasomotor symptoms. These are your hot flashes, or some people call them hot flushes. These can also manifest as night sweats. You're waking up in the middle of the night and you're wet and you're sweaty and you've thrown off the covers and now you're suddenly cold. So we call that collection of symptoms vasomotor symptoms, and they are the most common symptoms of menopause. But I do want to clarify, not every single woman gets vasomotor symptoms, and not every single woman who gets vasomotor symptoms gets them at the same severity. So you have some women who have very mild symptoms that they can almost even ignore. And then you have women who have disruptive symptoms that are so severe, they're interfering with their ability to function, particularly socially or in professional places. Other symptoms can be, again, the whole gamut. So many women will have trouble sleeping. They might find that their concentration, their ability to be sharp has changed. They may also find that they now have headaches or joint pain or digestive symptoms. You really can get many, many symptoms related to menopause.
How does menopause impact long-term health?
We know that there are many health conditions that start to increase in incidence and prevalence as women age, particularly after they've gone through the menopause transition. This will be things like your cardiovascular health. So, women listening should realize the number one killer of women is cardiovascular disease. And our rates of cardiovascular disease really start to increase after we have gone through menopause. We also see other diseases of aging, including things like cognition and memory issues, really start to increase once somebody has gone through menopause.
Mm. And when one goes from perimenopause into menopause, do the symptoms change or are the symptoms pretty much the same throughout?
No, the symptoms are not the same throughout. So I would say for most people, the perimenopausal symptoms are waxing and waning. They're coming and they're unpredictable, which is frustrating in its own way. But for many people who go through full menopause, they then start to have symptoms that are pretty consistently present. But just like the age of menopause varies, and just like the time in perimenopause varies, the time that women have symptoms after they've become menopausal also varies widely. The average amount of time women spend being symptomatic after menopause is 8 years. We used to think it was way shorter, but we have women who are still having symptoms of menopause 10 and even 20 years later. So everyone's experience is a little bit different.
Wow. Do most people know when they're going through perimenopause or menopause? Or is it one of those things where the doctor isn't warning them in advance? Do you feel like your own patients know what's happening to them when they talk with you?
I think we've reached an era where we have a lot more conversations around women, hormones, symptoms, health impacts. So I do believe that awareness has changed significantly, not only among women themselves, but also among healthcare professionals who previously never heard anything about menopause in medical school. I'm dating myself, but I never learned about menopause until I was a full practicing physician.
Whoa. And people are postmenopausal For decades, for half their adult lives, they're postmenopausal based on the numbers you shared earlier.
Right.
And you weren't taught about that.
That's exactly right. Maybe taught about aging, but never taught about it from the context of whether or not it was related to menopause and the menopause transition.
Half the adult life of your patient not being taught about that. Wow.
Well, we can have a whole conversation about women's health and how it has deserved more attention for decades, but I think that's going to have to be a different episode. I do think that there can be easy confusion around perimenopause and feeling like the symptoms are surprising and unexpected. And often people will have this aha moment when they put it together and they recognize, oh, it's at least partially driven by the fact that my hormones are shifting and they've become less predictable. And that is maybe what's causing my bleeding to change, my mood to change, how I perform at work to change. All of these are different things.
Are there racial, cultural, or socioeconomic differences in how women experience menopause and sexual health as they age?
There absolutely are. And unfortunately, we don't know enough about the differences. There's an ongoing study called the SWAN study, or the study of women's health across the nation, truly trying to discern what the variability is among different populations in their experience of menopause. But at the moment, what we know is that Black women tend to have more severe symptoms that last for longer, that are more likely to be undertreated. White women and Hispanic women tend to have symptoms for around 7 to 9 years. And then Asian women actually tend to have a much lower symptom burden that lasts for a lot shorter period of time. We also know that women in a lower socioeconomic bracket tend to have more symptoms, but that is independent of a woman's race and ethnicity.
Mm. Is bone health something that is affected by perimenopause or menopause?
Absolutely. We see a sharp decrease in bone strength or bone density as women go through the menopause transition. So much more common to develop osteoporosis after you've transitioned to menopause. And the other large area of the body we didn't talk about is vaginal health. Big changes happening with vaginal
Mm.
health could be dryness, pain with sex, loss of lubrication. And this can often be a symptom that some women feel modest about and
Hmm.
are struggling a little bit to bring it up to their healthcare professionals. Please talk about it. We have ways to help those symptoms as well.
I'm so glad you brought that up because I think that a lot of women are taught to be embarrassed about these very real parts of our body. It's just another part of our body. But vaginal dryness or a decreased libido, I think for some people it's scary to say those things out loud. What would a doctor recommend if a patient came forward and they said, I do feel like my libido is not what it used to be. My vagina, my vulva, my labia, other parts might hurt during sexual activity. If they say this to a doctor, what would the doctor recommend?
Well, that's going to be a whole complicated conversation around when are you having symptoms? How is it manifesting? Is it just pain with sex? Or is it pain at other times? Are you having urinary tract infections or UTIs?
Mm.
So, recurrent UTI can be associated with the vaginal tissue changes that happen after menopause. And all of those are going to respond to different approaches in treatment. In addition, if it's an issue of libido, as you know, that is enormously complicated. So, is that an issue of hormones? Is it an issue of the status of the vaginal tissue, or is it much more complex than that? Does it have to do with relationship dynamics, history of trauma, those kinds of things? And again, that's going to take probably a multi-pronged approach to figure out how you can help that person to move towards a healthier sexual life if that's what they desire.
Mm. One more thing that I think some people are embarrassed to talk about, but it's not uncommon, is maybe difficulty with holding urine or with pelvic strength. And that's related to perimenopause and menopause, right?
It can be, absolutely. So our ability to control the passage of urine or to be continent is
Hmm.
definitely related in many ways to the health of the tissue in the genital area. It can be related to other conditions as well, or to other parts of the urinary tract. But if you are struggling with urinary incontinence, so you're not able to hold your urine, maybe that means it leaks out when you laugh or you sneeze. Maybe that means when you have to go to the bathroom, you are running to the bathroom as fast as you can because you know you're not going to make it. Or maybe it means you're having full volume urine loss, meaning you are having full accidents. Please talk to your doctor about that and see what can be done to help with those symptoms.
Perimenopause usually lasts 4 to 8 years, marked by the unpredictable rise and fall of a patient's hormone levels. During this time, your periods may become less regular and can vary widely in terms of how frequent or how heavy they are. Next comes the menopause transition, when you'll stop having periods for 12 months. After that year, you'll have fully reached menopause status. Now, everyone experiences menopause differently, though typically it comes with vasomotor symptoms, which can look like hot flashes, night sweats, or even difficulty concentrating. After menopause, you'll have to take special care, as the rates of cardiovascular disease and aging diseases dealing with cognition and memory start to increase. It's also more common to develop osteoporosis postmenopause. Another important thing to consider is that your vaginal health can change too. You might feel dryness, pain, experience painful sex, or feel a loss in pelvic strength. In all cases, if you're experiencing discomfort or are uncertain if what you're experiencing is even menopause at all, it's time to see your doctor. Next, we'll talk about diagnosis, management, and treatment for menopause. Now, you alluded to it before. You said this is a much bigger conversation. We can't get to all of it today, but I do want to touch on it, that women's health has not always been taken seriously. It's not always treated with the seriousness that maybe men's health is treated with. So how can women advocate for their needs during doctor's visits if they're suspecting that they're having symptoms of menopause?
I would advise women who are suspecting that these are menopause or perimenopausal symptoms that they're navigating, that they come in with very clear questions, with a list of their symptoms to make sure that they don't forget anything, especially if they're working with a busy healthcare professional who maybe has that pressure to move through the visit, to be sure that everything they wanted to have mentioned has been mentioned and that their questions have been answered, or if they cannot be answered in that setting, that they request to have an appointment that's specifically to discuss menopause. There are more and more certified menopause consultants across the country. And so if that doesn't happen to be your longitudinal healthcare team, there's a good chance there's somebody in your community who could see you or somebody who could see you virtually from a distance.
Oh, that's fantastic. I've never heard of that. All of my life, I've been raised to think there's the OB specialist, obstetricians,
Yeah.
and then there's the gynecologists who take care of everything in your reproductive years. But the fact that there's menopause specialists, that's something that is new, I'm sure, to a lot of listeners too.
Yeah, there's a national organization called the Menopause Society, and the Menopause Society does a great job of educating healthcare professionals and allowing them to achieve that certification. So listeners who are interested can seek providers who've been certified through that website, the Menopause Society.
That's great. And when a patient is going to talk with a doctor about suspected menopause or perimenopause symptoms, is there specific testing they should ask for, diagnostics, blood work, and so on?
This is really important because you will see it vary across practices. For example, somebody who has both ovaries, who has her uterus still, she's been having bleeding all along. And now let's say she's stopped bleeding for a year and she's having hot flashes. You actually can make the diagnosis of menopause by history. You don't necessarily need blood tests to make the diagnosis of menopause. In some situations, you do need testing. Let's talk about a woman who's had a hysterectomy. She doesn't have a uterus, but she does still have her ovaries. So she's not getting that cyclical bleeding. She doesn't know whether she's gone through menopause or not. Maybe she has some slightly less classic symptoms, and you wonder, are you truly postmenopausal? Well, in that case, there are some very simple blood tests that are hormone levels that can be done to decide whether you think it's likely this person is postmenopausal or not. I will caution listeners to recognize, remember, we talked about how those hormone levels change throughout a cycle. So those numbers physiologically are changing across the month. So they're not always black and white to say, oh, this is
Mm,
definitely menopause or this is definitely not menopause. Sometimes they are. Sometimes they're in this gray area, and then we either need to retest them or at least interpret them in context.
all right. Let's talk about management and treatment. So, one type of treatment we hear the most about is HRT, also known as hormone replacement therapy. How can women decide if it's right for them? There's so much contradictory information that's been out there the last couple of decades about HRT. Is it safe? What should patients consider?
This is a huge question and so important. The preferred terminology now is to talk about hormone therapy or menopausal hormone therapy, so HT or MHT, because it is not truly a replacement of the
Mm,
levels of estrogen and progesterone that you had before you went through menopause.
mhm.
Hormone therapy is far and away the most effective treatment for symptomatic menopause. And many women, in fact, many more women than know it, are eligible to consider using hormone therapy. Just like any other medication on the market, there are pros and cons and risks and benefits that should be carefully weighed and considered before somebody decides to take hormone therapy. But unfortunately, in the last couple of decades, we've had pushback from some poorly reported medical studies that put fear into women about utilizing hormone therapy after menopause. And we're only just seeing us turn the corner and help women understand that so many of them are eligible for this highly effective, highly beneficial form of treatment, which is menopause hormone therapy.
What does menopause hormone therapy actually look like for someone who's decided they want to go ahead with it?
What that looks like for most women is going to be estrogen in some form. Our current preference is to use that as a transdermal estrogen, meaning it comes in across your skin. So, usually in the form of a patch. It also exists in forms that you take as a pill orally. It also exists in vaginal forms. But when we're talking about menopausal hormone therapy, the driver, the workhorse is going to be estrogen. If you still have a uterus, you will concurrently take progesterone, and that you're going to take orally. So, menopausal hormone therapy is usually going to look like an estrogen patch with an oral progesterone. If you don't have a uterus, you've had a hysterectomy, it might just be the estrogen patch alone.
When would one start that? Would they start it after they haven't had a period for a year? Would they start it after they first begin feeling really severe symptoms of perimenopause?
So, usually you would start hormone therapy when you're having symptoms that are bothersome. That might be in the perimenopausal time. That might also be after you fully converted to menopause. If you do it too early, the dosing might not be enough for you. So for many
Mm.
women who are perimenopausal, they haven't fully had that shutdown of their ovaries yet. They need a higher dose. They need a dose of estrogen that's more aligned with what you would get in an oral contraceptive birth control pill. But for women who are menopausal or nearly menopausal, they usually can use these much lower doses, which are much safer than those higher doses.
And then how long would someone stay on that hormone therapy?
The length of time that someone can be on hormone therapy will vary. Historically, we've heard people say 5 years, but that is no longer what we believe. We
Hmm.
really take this on a case by case, benefit to risk approach for each woman who we're counseling on whether or not the benefits to this therapy is helping them and outweighing any of the risks that are coming alongside that treatment. Because remember, I said for women who are experiencing vasomotor symptoms for a decade or even up to 20 years, well, that's not fair to only treat them for 5 years. If it's that disruptive, then you're going to treat those women with careful conversations and risk analysis for longer than the 5 years.
Absolutely. What kinds of non hormonal treatments are available for menopause symptoms or sexual dysfunction?
Yeah, that's so important. There is an entire list. So, your most quickly effective is going to be menopausal hormone therapy. Then we have an entire toolbox of things that could be used for managing menopausal symptoms that range from things like pharmaceutical medications. Usually, these have been antidepressants. Some of them have come from some of the blood pressure medications, for example, from a wide spectrum of backgrounds. But the FDA has approved one medication, paroxetine, which is known as an SSRI. So this is a medication we use for depression and anxiety. And now we use a very low dose of that medication for management of vasomotor symptoms. And in the last several years, we have a new agent that works by a novel mechanism. That medication is called fezolinetant. Remember, we talked about what's happening in the brain causing these hot flashes. This is how we're figuring this out. So it works on a very specific receptor in the brain, and that also reduces hot flash burden.
And are there any non pill treatments to consider?
Part of my background is working in integrative medicine. So I love to think about therapies that aren't necessarily coming out of a pill bottle. So some of
Hmm.
the most effective things we can do with that are things like cognitive behavioral therapy or CBT. It's a
Hmm.
specific form of psychotherapy. You might be surprised, Kristen, to learn that clinical hypnotherapy, so hypnosis, actually also works for hot flashes. And we'll
Interesting.
also
Wow.
use things like acupuncture breathing, although they don't have the same level of evidence as the pharmaceutical medications do.
Since you are a doctor who specializes in integrative medicine, I'm sure you probably have thoughts on how diet and exercise might factor into managing perimenopause and menopause symptoms.
Absolutely. Diet and exercise are going to impact your health no matter what stage you are at. So, if you're having a lot of symptoms, I think it's worthwhile looking at the health of your dietary pattern, recognizing when there are triggers, and then making your choices around those triggers. If you have a glass of wine and at 3 o'clock in the morning you're waking up with a night sweat, maybe skip the glass of wine if you don't want to have disrupted sleep. Exercise is critically important. So, important in terms of management of symptoms, maybe, but certainly important in terms of those other risks that increase with the menopause transition. So, that includes your cardiovascular health, your bone strength. It is so important at this phase that women are sweating and lifting heavy things. So we should be doing resistance training. We should be getting our cardiovascular workouts in. This is the time. It's never too late to start.
And depending on the exercise, it can possibly play a huge role in maintaining our pelvic floor health as well.
It can help so many things. It can help with your mood and if you're doing it socially, being connected to other people. There's so many great benefits to exercise.
For those in perimenopause and menopause looking for more guidance and answers, an appointment with a certified menopause consultant might be just what you're looking for. Make sure to take notes of all your symptoms so the two of you can discuss further. When it comes to diagnosing perimenopause or menopause, that can sometimes be achieved through assessing your personal history. In other situations, a blood test to measure hormone levels can help. Now that you've got your diagnosis, what are some ways to treat your symptoms? Well, menopausal hormone therapy is the quickest and most effective. You'll take estrogen, usually through a patch, and most people will also take an oral progesterone. When to start and how long the treatment lasts differs for each person. You can also get treatment in pill form through antidepressants or fezolinetant. Other treatment options can include clinical hypnotherapy, CBT, and even acupuncture breathing. One thing in your control is diet and exercise. Take note if certain foods seem to trigger your symptoms. For exercise, you can focus on improving your cardiovascular health, bone strength, and pelvic floor health. Next, we'll talk about how popular culture has changed its views on menopause over time. You've shared so much great information with us today, and you've mentioned the fact that this information is coming in stronger with time. I'm just curious, over the course of your career, from being a medical student to the present, how have you seen the medical world as well as society at large change their perceptions of perimenopause, menopause, and so on?
I've seen it change completely from a phase of life that nobody's talking about to a phase of life that so many people are talking about, recognizing that women don't have to stay symptomatic without assistance, that there are effective treatments. We see a lot of celebrities talking in this space. And I
Mm,
have to say, I think that's wonderful that they're being honest about their aging bodies and things that they're doing to help maintain their health. I also love a book that I featured on my Mayo Clinic podcast, Read, Talk, Grow, called The Change, where Kirsten Miller wrote a book that's a thriller about these women going through menopause who develop superpowers. And when we talked to her about it, she said, I want to change the narrative around menopause because it isn't this phase of life where women become no longer useful to society, shriveled up and just meant to be put in the corner. This is a powerful time for women. You tend to be wiser because you've had life experience. You might be more resourced. You might also be starting to see a shift in your responsibilities. If you've had kids, maybe they've been launched and you're not as directly responsible for them. So I'm really hoping that we continue to see more attention, more research, and this continuing narrative for empowering women for this back half of their life, which is so incredible and can be so rich.
oh, I love that positivity. I remember as a little girl watching The Golden Girls with my mother and my nana, and there was a very, very famous episode of the show where one of the characters, Blanche, is going through menopause, and it was considered groundbreaking and shocking, and then pretty much didn't happen again on TV for decades after that, where you had a major character going through menopause. I still vividly remember that episode. It was just not talked about. And I'm curious, in your patients, have you seen a change in how they talk with you about it?
Absolutely. I see people being more open to talk about menopause, to thinking about menopause as the cause for their symptoms. I also see people coming in with a lot of misinformation. So I do hope that people who are listening are hearing some of the things we're saying about what the symptoms look like and whether or not testing is needed, and have a trusted healthcare team that they can really have listened to them and guide them on what is useful, what is necessary. It's become quite a business as well. And we just want to be mindful that women are not being taken advantage of or being sold on something that's not effective or is potentially dangerous. So I've seen a lot of shifts in how these conversations go Mostly for the better, but some have been requiring a lot of unwinding of some rhetoric that's out there from some sources who are maybe with a business agenda or maybe just misinformed.
Mm. Do you have a success story that you could share with us about somebody who came in with menopausal symptoms? Maybe they were really struggling with them and then came out on the other side feeling better after their doctor's visit.
I don't have a success story. I have dozens of success stories. I have women who come in and many are just frustrated. They don't know what's wrong. They feel like they've aged. They're struggling in their relationships. They're struggling at work. They're moody and angry and hot and not sleeping. And they're perfectly eligible for hormone therapy within 3 months. It's as if the clock has been rewound and they are feeling back to themselves, back to being able to get up and go to the gym, put in the effort it takes to eat their healthy diet. It can really be life changing.
This is a bit more philosophical, but people often look at menopause as the end. This is the end of you being a sexual being. This is the end of you being a real woman, whatever that means. This is you going out to pasture. And it can also feel like just a loss of control of one's body. Is there anything you can say that maybe would help folks out there who are feeling not so positive, who are feeling bad about themselves during this time, especially because of society's negative perceptions around aging and women?
So, menopause is the end of your fertility. So, you no longer are able to become pregnant when you're menopausal, and you will have a harder time becoming pregnant when you're perimenopausal. Or you might become pregnant unexpectedly when you're perimenopausal because you don't exactly know when you're ovulating. And that quote end can be different. Some women will grieve that loss. Some women will not have had the number of children they wished they had had when they go through this transition. Some women will dance in the streets because they no longer have to be always aware of whether or not they could potentially become pregnant. But that is the only thing that comes to an end with menopause. So as the aging woman is able to stay healthy and stay thriving, she absolutely can still be a very effective member of society. She absolutely can be a very sexual being if that's what's important to her. She can stay strong and stay fit and do all of these different things, which comes back to this idea of the narrative doesn't have to be that you're no longer useful to society. Hopefully, in the 2020s, we know that women are not just here to birth children. Women are here for so many reasons, of which birthing children is one very beautiful aspect of it, but we contribute so much more to society, and none of that comes to an end, and in fact, might even be more empowered as you transition.
Oh, what a beautiful note to end on. And just a great reminder that we are a lot of different things. We're way more than what our uterus may or may not be doing right now. And there is so much out there to be excited about. As you said earlier, life is nowhere near over with because of menopause. You still have half your
Absolutely.
adult life afterwards. So
Absolutely. Go enjoy it.
enjoy it. One of my friends, she began what we call the white pants celebration on her 1 year anniversary after having her final period. She went out and she bought white trousers. And I know other women who do that now too. They buy white trousers or a white dress or white shorts, and it's just a way to celebrate. This is the next phase of life, and there's a lot of freedom here, including I can wear whatever color trousers I want to and not worry about it.
Absolutely. I love that idea.
Well, Dr. Millstine, this has been fantastic. Thank you so much for joining us today.
It was my pleasure. Thank you.
What we know about menopause and how we see it has changed a lot over the years. There are more resources now than ever, including your friends and peers who may be going through the same thing. So, if you're emotionally struggling with your transition into menopause, remember, While menopause is the end of a certain phase of life, it's also the start of a new chapter. Okay, that's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For links to resources Dr. Millstine mentioned in the episode, see our show notes online. And for more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps other people find our show. Thanks for listening, and until next time, take care and stay healthy.